Hi, I'm Colin Hung with Healthcare IT today, and I'm excited to sit down with these two gentlemen to talk about a very interesting part of healthcare, RCM, revenue cycle management, and the challenges we are facing in terms of our industry relative to this because of the staffing issues. Sitting down with me is Greg Goodale, Vice President of Marketing at CorroHealth. Welcome, Greg.
Thanks, Colin.
And also Jason Barnhouse, National Director of Enterprise Solutions at CorroHealth. Welcome to the program.
Thanks, Colin. Good to be here.
All right, so revenue cycle. But before we go there, and really what I want to talk about here is there's a big staffing challenge, and that's on the lips of everybody that you talk to in healthcare right now. It's the number one concern, number one challenge, and it's not just the frontline people, it's also administrative people, hard to keep and hard to find. What are you hearing, what are you seeing from your clients relative to the staffing issue?
Jason, you want to take that one?
Sure. Yeah. We're dealing with the quality of life concern. People are wanting to focus on things that matter. The administrivia of doing the day-to-day work within healthcare. They want to be able to apply their skills to things where they can really have an impact. So, the role of trying to find a way to build that quality of life for them through the use of technology and taking some of those components off of their plate that allow them to focus on the things they really like is what we're kind of focusing on.
Basically, it sounds like you're trying to eliminate any excuses for someone to go looking, right?
Right.
Make their job a lot easier,
exactly.
smoother.
Yeah.
I love it.
Yep.
I love it. So the new reality, of course, is, even though we come through the staffing issue, I think healthcare organizations are really recognizing they're going to have to learn how to do more with less.
Yeah.
They're not going to be able to just staff and solve the problem that way by adding more people. And of course, one way to do that is to solve it with technology. Do you think we're at a point now where people are recognizing that, technology can help as opposed to technology can replace people? Are you getting that sense of what's out there right now, Greg?
Yeah. So again, we've been attending some of the sessions, and you're hearing that. So where people were initially a little afraid, that's probably the appropriate term, of automation and AI and thinking that's going to replace my job. Now, with the Great Resignation, people are starting to understand, actually, I need this to help me do more. I've got more on my plate. The technology is there to support me and let me get back to doing what I'm supposed to do, and not all this administrative and just heavy workload that I could pass off to technology. So the mindset has shifted. Now it's not totally shifted. There's still people that hear that and think, oh, that's going to replace my job. But with the mix of there being such a massive hit to our staffing availability, I think we've finally hit the right market pressures that have said, okay, I understand. This is for me, and this is going to help me, do better.
Yeah, I think the pandemic obviously is a wake-up call on many fronts. Yeah. But one of the big ones was on staffing, to realize, oh my goodness, people really, when there was an opportunity to move, they moved, and now it's hard to hire back. And so they have to do more, and technology is a way they can have, we're going to only have 5 people now instead of 10, but those 5 can do it because I've got some technology to help. Now, in fairness, CorroHealth has never been about replacing people. That's never been a message of what you guys offer. Instead, you talk about something called upskilling people. By applying your technology, you're able to upskill people and have them really focus on, as you call it, those higher level, more interesting challenges. Why is that more important, or even more important right now?
Well, so, just look at autonomous coding, for instance. If you apply autonomous coding, what you're doing is you're turning your coders into auditors. So, raising their skill set, and that takes training and building them up so they're able to actually take on more complex cases, moving away from lab and radiology, those types of coding functions. If we can automate those things, we can move them into a reviewer position for that. And then take time to build their skill set so they can take on, same-day surgeries and inpatient coding ultimately. So,
Greg, you want to comment on that?
Yeah, honestly, it's investing in the people that we have that are staying loyal to us. So, you've got people that have been doing the same job, the same tasks for years, some of them decades in this profession, and they've stayed in the same role, and mostly because it's a need in the organization. They've gotten good pay raises and the organization's treated them well, but now they have opportunities with upskilling where we could take an ED coder as an example and train them on inpatient principles, and now they've not just increased their value to the organization, but they've also increased their own skill set for the job market that's out there. So they've advanced their career because we can offset some of the work that they're doing and give them the tools they need to become, their full potential.
I love it. Yeah, so you're basically eliminating a lot of the, I won't say mundane, because it's not mundane work that they were doing, but you're allowing them to practice at their higher skill set, to use that cognitive functions rather than the rote stuff that maybe they were doing before.
Yep.
So both of you are big believers in AI, it's very obvious. And AI in healthcare, I think we went through a big hype cycle a few years ago where it was going to solve every problem. AI was the ultimate thing. I think we've obviously come down off of that hype. Do you think, relative to AI, things have changed for the better now? Are we in a more realistic place in terms of what we expect out of AI?
Yeah, I do. Jason may be able to talk a little bit more about it, but really what we're hearing at the show is kind of one of those deep breath moments where you talk to clients and they're starting to understand, yes, this does have a role in my organization, but you want to hear from the whole industry. And there's been multiple sessions, multiple conversations, not just on the show floor, but in the actual sessions here at HIMSS that have proven that, to your point, we're getting past the hype session and people are starting to now tell their stories and say, here's the realities of how this worked when we rolled AI out, as an example, out in registration.
Right.
Here's what it looked like when we did that. And here's some of the things that people thought, oh, you can never change that. We've always done it this way. It's going to get it wrong. And they came out on the other side and said, hey, this is a reality. So I think we're there. There's always going to be a few holdouts, but I do think people are starting to realize that this is real. It's got its place, and they're starting to look at other areas to roll it out.
Yeah, and the patient experience is really coming into focus. So, the example I heard today was, you go into the doctor, you establish a new patient visit with your doctor, and you get a stack of paper.
That's right, you have to fill out the form.
Yeah, and it's typically information that you've already filled out for another doctor within the health system, or when you went to the hospital to have a procedure done. So the fact that we're trying to bring that to the forefront and having a patient verify their information that is already available, instead of asking them to restate it, and scheduling visits and that sort of thing, we're starting to see the convenience factor of healthcare that used to be terribly inconvenient and full of wait times and laborious work. So, the application of that in the industry to improve the patient experience has become really, really important. So,
yeah, let's talk about the patient experience for a minute there. Greg, over to you. How does improving RCM actually improve the patient experience? Because obviously the mind goes right towards that back-end process. How does that tie work?
Have you ever been frustrated with a bill that you didn't think was correct? That's at the end of the day, what we don't want is passing on costs that we can't justify to a patient.
Right.
And on the RCM side, where we're applying AI and automation, we're getting the proper reimbursement out the door. And we're supporting that with documentation that we can back up why that reimbursement is necessary and why those payments should be made. So on the patient satisfaction side, you don't want them becoming the intermediary that has to argue between the provider and the payer in saying, no, this is right, this is wrong. You want to get it right the first time. So.
And I think also within even further upstream in that process before it gets to someone who's posting payments and that sort of thing, even in like the inpatient space, when you're doing coding for inpatient, being able to highlight for an auditor what they need to be looking at instead of having them randomization of what they're looking at. So, spotlighting those things that have the high propensity for error and leveraging machine learning and grabbing the data in order to make sure that your predictive analytics are pointing you in the right direction. So, at the end result of that is when a patient gets a bill, it's right.
Right.
And, the satisfaction from that and the workload it takes off of a hospital of have to answer those calls of why is my bill not right and the 5 or 6 people that get involved in that process. So.
Which is very frustrating, right?
Yeah.
For all sides, for everyone involved.
Yeah.
Now, full disclosure, of course, we've collaborated recently on an ebook together about the road to RCM in 2025. I think the consensus amongst us was that RCM is going to look very different in 2025 than it does today. The biggest difference being that it's going to move towards being much more of a strategic function rather than just a back office function. What was your big takeaway from that ebook, Greg?
I was actually a little shocked. So one of the pieces of research that came out of that one was the people that are at risk in healthcare. So we had the great resignation and people leaving, but there's still the survey, I think it was ADP that did the survey that we cited in there. There's still a massive chunk of people that are at risk that say, you know, if a good opportunity came up, I'd be on the look. And it ended up being, I think it was 6 out of 15 people on a team of 15, 6 are
in
safe.
that category. Yeah.
And that's not good. So we need to be planning. Not only do we need to be doing things that are, you know, trying to keep our team members happy and giving them work-life balance and giving them career paths and all the good things that an employer does, but we've got to look at technology to say, if tomorrow my team of 15 goes to 6, and I've got all these gaps of months trying to hire these people, how in the world am I going to handle all that workload if I've got people that could be at risk? So that was a big one for me.
Well, and COVID, you know, forced the hand of many people to make very quick responses to, you know, a situation that was totally out of our control.
Sure.
So, you know, the thoughtfulness around how do you apply, you know, this technology to make sure not just your patients have a great experience, but that your staff is enjoying what they're doing.
Yep.
And that they feel like at the end of the day what they're bringing to the table is valuable and that you know is recognized. I think more than anything that your staff is feeling like that they're being recognized for the work that they're doing because it is valuable. So,
Greg, final question for you. Where can people go to find out more information about CorroHealth?
Simple, CorroHealth.com. We're big on LinkedIn. Go to LinkedIn, please follow us. We'd love to connect with you there, but we put everything on the site, so it's a great place to go.
Gentlemen, thank you. This has been a fantastic conversation. As always, it's always fun to chat about RCM with the two of you.
yeah, it's great.
Thanks,
to be
Colin.
with you.
Hey, if you enjoyed this interview as much as I did, please like and rate us and subscribe to our channels. Also, head on over to healthcareittoday.com where you can find the latest news and industry insights. And you can always follow us on Twitter using the hashtag HITSM. I'm Colin Hung. Thanks for watching.